that you're on prescriptions and you want to take herbs and you're nervous about how to do that. How many people are kind of in that? So just one person raising their hand. I have a feeling there might be a few more.
Not me, but my husband.
Okay, and that was going to be my next question. How many people, because they want to practice herbs on other people who are on prescriptions, whether it's family or friends or it's business, and they are, okay, cool. Just to get an idea of what my community is. So my name is Maria Noel Groves, if you don't know me already. I'm a clinical herbalist. I run Wintergreen Botanicals, which is a little clinic and education center out in Allenstown, and I also do quite a bit of writing. I write for Herb Quarterly, and I used to be an editor for Natural Health Magazine and a bunch of other odds and ends. And I've been teaching I teach about 100 classes a year, and I've been working with herbs for about 15 years now. But there's always more to learn. So as anybody who's been working with plants knows, there's just always more and more to learn. So this topic really interested me. We wanted to do an advanced topic, and this is one of the few areas where I feel like amongst my peers, I have something to say, whereas for the most part, I think I'm kind of right in with most of the other folks here, formulating. I don't have that much new to share. But this is an area that I think there's a lot of anxiety about, working with prescription medications and herbs side by side, and it's really not that difficult. It's not quite as scary as it seems, but you still do need to do your research and listen to your intuition and a lot of other things alongside it. So I'm just going to kind of take you more through the process of how to do that research personally or for somebody else, and less about these herbs, these drugs, combinations, because the possibilities are infinite, and it's really like almost impossible to remember all of them. Come on in. It looks like we've got one more set of handouts here.
This one?
Yeah. Come on in and sneak in there.
There are no chairs left.
There are a couple chairs in the back. There are a couple chairs in the back, and if we need to, we can bump in. So how about if we have this group over here just kind of smidge in a little bit? And maybe, and you might want to angle a little bit, because I'm going to hang out here in this little corner. So I want to start off with first off, thank you all for coming. This is a really exciting event, and it's great to see so many people coming to it. I want to start off with kind of my 4 basic safety rules, and this is what I tend to start off most of my classes with. So if you've been in some of my classes before, I apologize that you're hearing this again. But it ties in really well, too, with what we're saying, what we're talking about here in class. Of course, FDA disclaimers that, none of the things that I'm saying are FDA approved, blah, blah, blah. But even more important than that, I think it's really important if somebody's going to start taking an herb, that you really, and especially if it's a new plant for you and you're not familiar, you haven't worked with it before, I really strongly recommend looking it up in at least 3 different resources or learning about it from 3 different teachers so that you get a wide view of how it's used. Because everybody's going to have a slightly different take. Some might give you every side effect under the sun, which is great background, but usually doesn't give you a whole lot of information on how to use it. Some will give you, more folk uses, some will give you more medical uses, and they all have their validity. And you're going to kind of decipher through that and figure out kind of what makes sense with you. But if you use just one resource, a lot of times something really big is missing. Like, for instance, one of my first herbals that I've since discarded, but had this nice long write-up on lily of the valley, how wonderful it was for the heart and this and that. And yes, it does have a lot of great uses, but it never mentioned that it was a toxic plant. So that was kind of a big missing piece. So I'd like to get my information from a couple different resources, at least 3. And on my website, I have recommended books. I've got, on the links page, I have some of my favorite folk herbal and science-based herbal websites for information, so that's a place for you to start. And of course, the teachers, the people who are here and elsewhere, are other sources of information. Along with that research thing, I'm a researcher, I love to look things up. But besides just researching and information, it's really important to take stock of your own body, your own intuition, what your body is telling you, and that is at least equally as important. So trust what you're drawn to, what you're not drawn to. If you take an herb or do an herb and drug combination and you just don't quite feel right, even if you have not read anywhere that there might be a problem, I would listen to that. Listen to what your body's telling you. And likewise, too, people will find that by listening to their bodies, they'll find out, like, yes, this is okay, I feel good doing this. And there also is an intuitive side of that, too, where it's even beyond just listening to your body's symptoms. or positive symptoms or negative symptoms. It can also just be listening to your body's intuition and what voice you hear in your head saying use this herb or what the plants tell you. And I think that's at least as important as the research, but I like to do them both. Also, if you're going to be doing any wildcrafting, it's really important to I think I'm just going to close this door for a minute. If you're wildcrafting, it's really important to make sure, or harvesting from your garden, to make sure that the plant you're harvesting and taking really is the plant that you think it is. And that seems like a duh thing, but there are oftentimes mistakes. A lot of times when you buy things from a garden center, it might be slightly mislabeled, or when you're out in the wild, especially if you're just getting started, there are some easy mix-ups. The good news is it's very rarely toxic. There are some deadly poisonous plants out there, but there aren't very many. Most of them are relatively safe. So you probably won't kill yourself, but I wouldn't recommend trying that as your way to decipher the plant. So you want to use plant ID guides, maybe watch the plant for a year, get to know it, do Google image searches. They're not perfect, but they'll give you an idea of different phases of the plant life. So those are some ways to kind of confirm that it is the plant that you think it is. And then last but not least, and we're going to go more into this, but if you're on prescription medication, always, always, always check with your pharmacist before you start taking herbs for herb-drug interactions. And I, as a practitioner, would still recommend to my clients that if they're going to take, I'll do a lot of the research for them, so there really shouldn't be any issues. But I still recommend to them to let their pharmacist know what they're taking herbally, show them the bottle or whatever, and also let their doctor know too, because I just think this is that integrative side of herbalism. We're all working together to try to make someone feel better. And so it's important for there to be communication. The pharmacists generally have the best databases. They don't have it all memorized. They have taken a lot of classes on it, but they don't have it all memorized. They just have really good databases at their disposal. And nothing is totally perfect because we've been using herbs for as long as humans have existed, if not before. The Iceman was using herbs, animals use herbs. We've been using pharmaceuticals as we know them now for only maybe 100, 200 years, not that long. And we've had more and more and more types of pharmaceuticals out there. And we've only been combining herbs and drugs for a very short time, just a couple decades, really. And there are infinite possibilities. So there's no way that we can 100% know what the herb-drug interactions would be, across the board. There's just no way. But we do have theories, and the good news is it really doesn't happen that often that there is a really negative side effect. It happens sometimes. Most of the ones that you'll find when you're reading them up in books, and I use books quite a bit for this, most of them are theoretical. So it's, well, this herb works this way, this drug works this way, this drug interacts with these kinds of drugs, these herbs work kind of like these drugs, so then we'll not use the herbs and the drugs together. Not necessarily because there are case studies of it happening. It's more theoretical. It's still important to take those into consideration, but just know that it's more of a theoretical risk. And there are varying degrees of how cautious or not cautious people are. I'm probably pretty on the cautious side. It's just kind of my personality. And then there are some where there are actually case studies of herb-drug interactions, like in the case of St. John's wort. There were a couple people in a row who were on anti-rejection drugs for transplants, and then they ended up rejecting that because the drug levels were cleared out of their system too quickly from the St. John's wort, and that's when we discovered that St. John's wort works on the liver pathway that clears a lot of drugs out of the system just a little bit more quickly than we'd like. It's a good thing. It's actually clearing out toxins out of the body, except that those, in this case, the toxins are the pharmaceuticals that people were intentionally consuming, and it changed the blood level. So it was not good in that situation. But very rarely is it actually a case study of people actually having the side effect. So it's important for us to know how to kind of cautiously work with herbs and drugs, because more and more people are on pharmaceuticals and more people are getting back into using herbs. And it's just, I really like to empower everybody to be more educated about what they're taking and become more at one with the decisions. No matter what you ever choose to do in your life and your own health, whether you're going totally pharmaceutical, totally herbal, or a combination of the two, the more educated you are about it and the more you really choose what you're doing, the better you'll feel about it. So first things first, I really want to state that I'm coming from my own practice philosophy, and I'm a very cautious herbalist. Probably more cautious than I need to be. Doesn't mean that I don't ever make mistakes, but I'm more on the side of caution. And in most cases, I could probably do something that would be fine, but I'm just being a little bit more careful because I am one of those people who tends to hear all the occasional horror stories of people having drug interactions, herb side effects, those kinds of things. So I just tend to be careful. It's kind of my practice philosophy, though. There are a lot of herbalists with very different practice philosophies who are completely wonderful, excellent herbalists. So I'm not, this isn't necessarily the only way, but it is kind of my viewpoint. Also, like I said, you're going to find a lot of viewpoints out there, and they're all good. You're going to probably want to listen to them and come up with what works for you, what sounds right for you. Herbs are generally very safe. They can have side effects. I do see people, especially when I teach classes and I'm talking to lots of people, or when I used to work in natural food stores, I would get feedback from people pretty regularly. And most people had positive side effects from herbs, but every now and then somebody might get a little bout of diarrhea or a skin reaction or something like that. Usually, a little tummy upset. Usually not something really dangerous, but something kind of unpleasant. And so they might choose a different herb. There are lots of plants to go from. So usually herbs are very safe, and when they do have side effects, they're usually not dangerous side effects. Approximately 0 to 1 or 2 people a year die from taking herbs, internally as medicines. Over 100,000 people a year die from correctly prescribed medications in hospitals alone, according to the Journal of the American Medical Association. So when I hear people say, I'm really nervous about taking herbs, I know they're really dangerous, you really have to be careful with them. Yes, you do want to be knowledgeable, you do want to be cautious, you do want to do your research, you do want to listen to your body, but keep in mind that really in the grand scheme of things, they are so much safer than pharmaceuticals. That said, pharmaceuticals can be life-saving. When I had a kidney infection, I went on antibiotics immediately, and so, you've got to kind of pick and choose what you're going to do. Pharmaceuticals definitely have, more of a safety concern. Herbs can still be dangerous. There are some that are poisonous. Sometimes people do have more serious effects. I have seen people with red yeast rice, which isn't an herb, but it's a natural supplement. I have seen people's liver enzymes go up. I have seen people get high blood pressure spikes with licorice. It does happen. It's not super common, but it does happen. And one of the things that I'm kind of firm on is I really don't feel like herbalists, and this is my practice philosophy, it's not rule, I really don't feel like herbalists should be giving advice on pharmaceuticals, because that is not our MO, that's not where our training is. I think the doctors and the pharmacists are better at giving the advice, but I do like to work in combination. So I don't tell my clients, stop taking this pharmaceutical, start weaning yourself off in this way, you need to go off of this pharmaceutical. But I do have clients who come into me either on several medications. I had one several years ago who was my age, maybe a year or two older, and was on 10 different medications. And she was not coming into me for anything that those medications were working on. She was coming into me for other things. And so I needed to find some things for her other health concerns that were not going to interact with all the other, all the pharmaceuticals that she was on. And there were a few herbs I avoided for that reason, but for the most part I was able to use most of the herbs that would have been my first choice, even if she hadn't been on those drugs. So there's that scenario. There are also people who want to get off the medications they're on, and I will help people with that, but I want them to also work with their doctors and let their pharmacists know, but especially work with their doctors to find out how can I wean myself off that drug. It's really not my job to say cut your pill in half and keep going. And it's also, especially if you're doing this as a business, if this is your job, it's one thing if it's your husband or your wife and you're telling them you can say whatever you want, more or less. But if you're doing it as a business, there's a huge liability there too. But it's also an ethical concern. I'm not trained in pharmaceuticals. I'm trained in herbs. I have had clients who take my advice and then they do whatever they want to do with their pharmaceuticals, and that's up to them, but I've given them their suggestion that they should work with a doctor. So that's kind of my belief. I also do get nervous, although I like to hear doctors recommending natural, safer remedies. I also do get a little nervous when doctors give lots of herbal advice, because usually the doctors aren't as heavily trained in herbs as the herbalists are. There are the naturopaths, they kind of bridge the gap a little bit. But when a regular doctor is giving lots of herbs, sometimes it's good, sometimes it's not, it depends. We all need to unfortunately work together, fortunately, unfortunately. So a lot of times, if somebody's on pharmaceuticals, it's not a death sentence. It doesn't mean they can never take herbs again. Like I said, there are really a lot of them that are fine to take, and those interactions are relatively uncommon. I will also recommend, I will ask the client to talk with their doctor, to let their doctor know I want to go off of these medications. How do I wean myself off? Are they open to it? Some people need to be reminded that they choose their doctors. So if you don't like your doctor and you're like, my doctor won't let me, my doctor doesn't believe in herbs, this or that, find a new doctor. I mean, it's a little bit of a pain to go do that search, but ask around, find out who's okay. I love my PCP. I can talk to her very frankly and say, look, do I really need an antibiotic? And she can say, no, just use the neti pot. And I'm like, okay, good, I'm good to go. So, you know, you can find a doctor that's willing to work with you. So sometimes people need to be reminded of that too. But I do recommend that. So now you've got somebody who's coming in, they're on prescription. There are two scenarios here. There's one where they are on prescriptions and they're looking for recommendations on something else, and you just want to avoid, you know, interacting with those. And then there's also the scenario where somebody wants to maybe wean off of a drug and switch to an herb. That's a little bit trickier, but it can be done too. It can be done really well, actually. And usually because herbs have fewer side effects than the drugs, as long as the herb works for them as well as the drug does, they're usually better off as a result. So